Hi guys, my name is Brian. I'm a science teacher and I run an addiction and recovery blog called the Concrete Confessional Blog. What I'm going to talk about today is how to taper off of physically and psychologically addictive substances. So I'm going to focus on physically addictive depressant substances, specifically opioid painkillers are going to be sort of the substance class that I use for all of the examples today. But a lot of what I have to say will also apply to tapering off of benzos. It will apply to tapering off of other psychologically and physically addictive drugs, like for example, cocaine, amphetamines. It will even apply to caffeine, nicotine, and pretty much even a lot of psych meds. So especially when it comes to the psychologically oriented tips, there will be broad applicability. But for today's video, I'm focusing in on opioids for example purposes. Now, one thing I have to say right at the outset here is that I am not a doctor. I was actually on the medical path for many years. I studied physiology and biochemistry in undergrad. That's what my degree is in. And I also completed my first year of med school, what doctors call their MS1 year. And at the end of that year, I did really well academically, but my life was absolutely falling apart from addiction. So I took a leave of absence and I never went back, which is one of my greatest regrets. But at the same time, it would have been awful to be an impaired doctor and not to be able to heal people the way that I wanted to, and potentially even even hurt them in being reckless or negligent or something like that. So but I bring that background up because I do have more knowledge about this stuff than a layperson. I have studied biochemistry and physiology for years, as a full-time occupation, and I'm able to read things like peer-reviewed studies with the eye that was developed through those thousands of hours of studying. So having said that, though, I'm not a doctor or any kind of clinician. So what I'm saying today is like the combination of book knowledge from all of that studying and just my own distilled personal experience, because I've tapered off of benzos and opioids several times, and I've also quit both classes of substances cold turkey. Do not recommend it. I have had withdrawal seizures from benzo withdrawal that just set me back permanently, neurologically. So long story short, I've got skin in this game. I'm tapering off of methadone now. I started at a high dose, right over 200 milligrams a day, and I'm down between half and 2/3 of the way through the taper. So I'm going to make a separate video discussing how it's going, but just know that I have gone through this many times in the past. I'm going through it now, and when I'm sharing these tips, it's basically a combination of what I understand about the theory and practice from medical training and what has worked for me. So I'm sharing these in the hopes that you will sort of take them under advisement, and when you're consulting with your clinician, ideally, bring some of them up and incorporate them into your own taper protocol. Everybody's different. Everyone's situation in physiology and genetics are different, so every taper plan is going to be a little bit different, but there are so many things I want to say today that I think will be very helpful, especially to people, again, who are tapering off of benzos and opioids. So not a doctor. Use this information in consultation with a clinician when you're planning your taper, please. If you're tapering off of benzos, barbiturates, and alcohol, those can cause seizures, as I just mentioned, and you can go into something called status epilepticus, worst case scenario, which is kind of a nonstop seizure, and you can actually die from that or have permanent irreversible brain damage. So if you particularly tapering off of those three substances, you've really got to do it under medical supervision if you're doing it really quickly. Okay, so with that all said, just want to get right into it. And the first thing I want to do is just briefly overview the theory of tapering, okay? And it's quite simple and intuitive. The theory is if you stop a substance cold turkey, that is an incredible physiologic trauma to your system. There is actual brain damage that happens when you stop benzos or opioids cold turkey. Your body has no time to adjust from being dependent on a really heavy depressant up here to going back down here. And because of that gap is just really difficult for your mind and body to bridge. So you get all the awful withdrawal symptoms from, extended anxiety, insomnia, sweats, restless leg syndrome, muscle aches, terrible digestive disturbances, all those classic opioid withdrawal symptoms, and because of that you're damaging your mind and body along the way. Now your body and mind are incredibly plastic. Most of that damage is healable, but there is evidence that if you do this to your body over and over again in the course of what will hopefully not be a long repetitive attempt to get off of these substances, but the truth is for most people it does become that. For most people this is a cyclical thing, especially addiction to opioids, and there is evidence that if you go through this many times in your life, there is some damage that might not be fully reversible that happens from really severe withdrawal. So with tapering, we want to minimize the severity of the withdrawal symptoms by decreasing the physiologic shock to your system. And the way that we do that is we do this as slowly and gradually as possible. That's all that a taper is. It's instead of stopping cold turkey, all of a sudden 100%, we decrease by 5, 10%, 5, 10%, 5, 10%, all the way until we are off of the substance. And in so doing, we take that huge ugly ball of symptoms and we minimize it. We actually make it smaller, and then we spread it out in these little chunks that we experience bit by bit along the way with rests in between. Okay, so that is the theory of tapering. And if you're ever trying to implement your own taper and you're sort of like considering changing something, tweaking something a little bit, run it by that theory and make sure that what you're considering doing makes sense, that it's coherent with that theory as I've just sort of outlined it. Okay, so without further ado, I want to get directly into my tips. So the first tip is to go slow. This is the golden rule of tapering. Okay, so the next thing you're going to ask is, what does go slow mean? And it means for opioids and also for benzos, don't decrease your dose by more than 10% in one increment. Okay, so Heather Ashton, who wrote a really famous guide for tapering off of benzos, called her method, which had over a 90% success rate, is called the Ashton method. You can find her manual free online if you go to her website. She said you can go to as high an increment as 1/8 of your dosage for benzos. But that's going to depend on how long you've been on them. It's going to depend on your own ability to tolerate discomfort. And long story short, I think it's safer to stay in that 5 to 10% range, especially for opioids. Okay, so if you are on 8 milligrams of buprenorphine a day at the beginning, you might go down by 0.8 milligrams. If you're feeling strong, you might go down by 1 milligram in the beginning. And after you do that, crucially, you've got to let your body re-equilibrate. Okay, so what that means is you got to wait till you feel comfortable on your new dosage. Now, how long that takes is going to be very variable in between different individuals, different substances, different tapering circumstances, different levels of stress and sleep deprivation. But if you need a rough ballpark for most depressant substances, you're going to be waiting at least 5 or 6 days after your decrease, and you might very well be waiting 2 to 3 weeks until you sort of get used to that new lower dosage of whatever medication or drug you're taking. Okay, so that is rule number 1, is go slow. Don't decrease by more than 8 to 10% rather, or 1/8 of the dosage at a time. Okay. One thing I want to mention is if you are taking a very short half-life opioid, so if you are taking something like oxycodone, which only lasts for 4 to 6 hours, you will probably need to switch over to a longer half-life opioid, such as buprenorphine, Suboxone, or methadone. The reason why is when a drug has a really short duration of action and it has a really short half-life, it doesn't last in your body for long, you get too many spikes, you get too many ups and downs. So you're trying to get this smooth curve of reduction in this chemical's presence in your body, and instead you end up with something like this. Okay, so you're either over medicated or you're in severe withdrawal, and you never get that nice gradual slow down of the level of the substance in your mind and body that allows your body to just gradually adjust to a new set of circumstances. So you might need to switch to a longer half-life agent for your taper. That's very common. Methadone and buprenorphine are the most common agents to use for opioids. If you're tapering off of benzos, you can use Librium, which is chlordiazepoxide. You can use diazepam is one of the drugs that Heather Ashton used in her original protocol. Clonazepam is another one that hangs around for a little bit longer. So that's just a quick note. So we're going to go slow. That's a golden rule of tapering, and we might need to use a longer half-life agent so that we can get that nice gradual reduction in blood level that allows our body to adjust smoothly to the new set of dosage intakes, basically. Okay, so that's rule 1. Rule 2 is go low. Now, when I started getting off of Suboxone for the first time, this had to be in, I think, 2011 or 2012. You take 8 to 16 milligrams usually a day of buprenorphine sublingually will get you to the ceiling dose level, okay? And I had multiple doctors tell me in 2-3 different treatment settings, once you get down to 2 milligrams a day, you can stop it, and it's just psychological withdrawal. You're not going to feel anything physical at that point. And we know now that that is complete BS. 2 milligrams of buprenorphine, it's a long time since I've looked it up, but that's something like maybe 40 or 80 milligram morphine equivalents. Like, that's a really, really heavy dose of a strong opioid still. So you are absolutely still going to have withdrawal if you only decrease to 2 milligrams of buprenorphine per day. You need to go really low on your taper. So rules 1 and 2, together the golden rule of tapering: go slow and go low, okay? So with something like buprenorphine, again, you're taking 8 to 16 milligrams per day. When you're on a maintenance dosage, you want to get down all the way to like 100 micrograms, 0.1 milligrams, maybe even 0.05 milligrams, 50 micrograms. Like, this taper will go like this for most of it, probably. Maybe it will slow down a little bit toward the end, but it should have a nice long tail at the end. I tell people, if you do a taper artfully, you will almost not notice when you stop taking the substance at the very end. Like, your body will be so close to dependent on nothing anymore. In other words, you will be taking such a small dosage, it's almost like it has no effect on your body. And that can really help with the psychological aspect of tapering, because it's like it sort of plays into you're not building it up in your head anymore. At that point, you're not even sure if you're taking anything anymore. And so it just kind of drags on to a point where you're like, oh, I don't need this anymore. Like, oh, you realize after a couple of weeks, like, I haven't felt anything from this in days. Like, I just don't need this anymore. And then you stop the next day and you're free. It doesn't feel any different. So go slow, go low, and go to a very low dosage of whatever substance you're taking. So I tell people you should go down at least as low as, like, okay, say you're taking hydrocodone, and maybe you were taking 10 milligram pills, and you were taking 1 pill at a time to start with. Well, remember, when you took 10 milligrams of opioid in an opioid naive system, that got you a pretty powerful effect, right? So when you taper down off of hydrocodone, you're going to want to go lower than 10 milligrams before you jump off. You're going to want to go at least down to 5 milligrams, which is the lowest prescription formulation of hydrocodone that I'm aware of. Like, you got to go all the way down to a dosage level that is not producing really powerful effects in an opioid naive person, because your body is essentially almost becoming opioid naive again. By the end of your taper, your tolerance will be so far down that, like, if you were to take your initial dose at the end of your taper, you will be absolutely smashed. In fact, you can't do that. It's a very easy way to overdose and hurt yourself badly or even die. Okay, so what I'm getting at with this is you have to go, there should be a long, low dosage tail at the end of your taper, okay? The other thing that this does is it minimizes the severity and the duration of pause. These are post-acute withdrawal symptoms that can pop up weeks and months after acute withdrawal is over. Your body can kind of revive the experience of withdrawal, which can be really discomforting and unexpected. It can happen when you get sick with the cold or flu. It can happen when you're stressed. It can happen when you're not sleeping well, okay? And one of the ways to minimize pause is just to do a really slow, gradual taper with a long, low dosage tail at the end. If you do that, it's highly unlikely you're going to be experiencing pause that is anywhere near as severe as it would be if you do a rapid taper or you do cold turkey with no taper at all. Now, the other question I get very commonly is, okay, Brian, you're telling me to go like all the way down to zero point 0.1 milligrams of Suboxone. Like I get these 8 milligram strips. How in the world do I reliably like cut that into one tiny little 0.1 milligram dosage increment? And the answer is that you probably don't cut it, okay? You probably have to use volumetric dilution, okay? So that means you take that strip, you dissolve it in a fixed volume of water, you make sure it's mixed up really evenly, and then you figure, okay, I've got 8 milligrams in maybe, let's just say 8 milliliters of water. So that means every milliliter is 1 milligram, and if I'm trying to get a tenth of a milligram or 100 micrograms, my final dosage, then I'm going to take a tenth of a milliliter. You would have to use more than a tenth of a milliliter to be able to measure it out accurately, probably, depending on the equipment you're using. But yeah, all you need is like one of those syringes that you can use, like an oral syringe to give a baby medicine. You know, they will have increments of milliliters and fractions of milliliters, and you just dissolve whatever substance, whatever pill or powder it is, in water, and you use volumetric dilution to figure out how much water equals the fraction of the dose you're trying to take. Now, if you're working with a clinician on this, they can probably prescribe you either a weaker version of whatever substance you're taking as you progress on your taper, or they can even send it to a compounding pharmacy, which can make a custom dosage with really high precision. So if you're working with a clinician and it's worth it to you, you might be able to do it more precisely by consulting with your clinician and a pharmacist. But if you got to do it yourself, the good old-fashioned volumetric dilution always works. If you guys have any other tips on how to get the proper dosage, please drop it below. If you got any questions about how that works and you need some input, just ask a question in the comment section below this video, and I am always totally ready to help with any formulation. It's like a challenge. Like, give me the formulation you're taking and I will find a way to get you an accurate dosage in whatever it will dissolve in, using equipment that you can buy like for under, $5. So, okay. Third tip is to incorporate rest areas in your taper. So you don't want to set out a taper, in my experience, and say, I'm going to decrease 10 milligrams per week for 10 weeks until I'm off of 100 milligrams of substance X. Okay, you're going to burn out. Even with a slow, low taper, there is going to be some discomfort along the way. In particular, when you're coming off of depressant drugs, you are going to have insomnia, you're going to have anxiety, and it wears on you. It's really tough, even if you've built up skills in therapy, it's really tough to stay uncomfortable all the time. So my third tip is incorporate rest areas along the way. Pick a time when you've got a lot going on with work and just don't decrease for 2 weeks. Let yourself really get comfortable at whatever dosage you're at. Or you could do the sort of inverse of that. You could pick a holiday time, a vacation time, when you really just want to be present and enjoy things with your friends and family, and you could take a break from tapering then. So rescue areas will prevent you from getting burnt out and overwhelmed by ongoing withdrawal symptoms. You'll also find that sometimes you think you're equilibrated to a new dosage, but as you keep decreasing, you realize it's starting to catch up with you. You weren't as fully adjusted to the newer, lower dosages as you thought you were. And in that case, incorporating some rest areas of a week or two can allow you to truly adjust to the new dosage, so that, again, you don't burn yourself out or put yourself through this this physiologic shock. Because again, there is no inherent value in that kind of physiologic shock and suffering. It's not just ripping the Band-Aid off. It makes the whole experience cumulatively worse. It's tough for your body. There might even be some permanent damage depending on your situation. So there's no need to push this too hard with the tapering, and taking rest areas along the way can really help you to just sort of properly, slowly decrease your dose in a way that your body can keep up with. All right, so my next tip is the most controversial one on here, and it's controversial because it is really dicey. And if you're not sure if you can rein yourself in and use it responsibly, I suggest not using it at all. But what I'm talking about are rescue doses. So this is especially if you're doing a more ambitious taper for whatever constraints and reasons you have. If you are decreasing so quickly that you're having significant withdrawal symptoms, a rescue dose is like you say, okay, I've been doing this a month. I have 2 more months ahead of me. I'm going to give myself 1 day of taking a dose that makes me comfortable, okay? And I'm just going to allow myself to sleep, to feel not anxious, and just to exist in non-discomfort for a while. That's a rescue dose, okay? And the question of how much to take to get to that state and not have it be dangerous or not have it be overtly intoxicating depends a lot on you and whatever substance you're in, whatever substance you're dependent on. Okay, so usually it would be about 50% or 75% more than whatever dose you are currently at in your taper. So let's say you're taking 50 milligrams of methadone a day. A rescue dose day might be 75 or 80 milligrams. That's going to be enough of an increased dose that you feel like some real overt relief. And there are legitimate rehabs and withdrawal detox protocols that use these methods because, again, it's that thing of giving you a breather. It's that thing of, it's so exhausting to be uncomfortable all the time. So the problem with this is it is so easy to overuse these, to talk yourself into doing this like every third or fourth night. You do it once a week in the beginning, and then you do the addict thing and it becomes, twice a week, and then it becomes like, oh, I'm having a really bad week, so I'm going to take more this week, and then you're right back where you started. Your body is dependent on whatever dosage you started at, and this can happen really, really quickly because your body becomes re-addicted much faster than it becomes addicted and dependent in the first place. So you can, if you're using rescue doses, it has to be like once in a blue moon. Like if you're doing a 6-month methadone taper, I would say maybe 2 or 3 rescue doses maximum. And one good way to keep yourself in check with tapering in general and with rescue doses specifically is get some outside help. Get a clinician, maybe a counselor, or a doctor or a nurse practitioner, like someone who really knows you and who's invested in your outcome, and bring them onto the project. You know what I mean? We all need people in our corner, and like you can tell them this, and you can tell them, I think I'm going to do this. I'm going to give myself 1 rescue dose. I want to be accountable about this. Maybe you have another thing I want to talk about is a lot of us, including me, we need to give our drugs to someone else to ration for us during the taper. It becomes so tempting to just, I'm going to take a little more today and I'll make up for it tomorrow. That is addict thinking, and in the beginning of your taper, it is very hard to resist before you sort of retrain your mind to talk yourself through and around that impulse. So you're probably going to need help rationing these drugs, especially as you get closer and closer to the end, or as you're more uncomfortable along the way. Okay, so with rescue doses and with tapering in general, one way to keep yourself accountable and responsible is to talk to someone else about it. Again, a rescue dose should be like 2 or 3 times in the in the course of an extended taper. This is not something that should happen with any regularity, and if you aren't sure if you can keep yourself limited in using rescue doses, it's better just not to use them. Okay, now the next point is it might seem obvious, but it is really, really important. You need other medications. Getting off of a medication, sad fact of life, is greatly made easier by using comfort meds properly. We're coming off of benzos and opioids. These are incredibly potent medications that adjust and change every part of your physiology and mental function. So when you're coming off of them, even if you do the slowest, most gradual taper possible, there are probably going to be times when you need help from some other medications. Okay, so for opioid withdrawal, for example, you're going to want something like hydroxyzine, Atarax, it's an antihistamine that's used for anxiety and for sleep. There's clonidine, which is an alpha blocker, a type of blood pressure medication that helps with the restless leg syndrome, also with the anxiety. There's gabapentin, which is a drug that works in a really interesting kind of unique way, and it helps with nerve pain. It helps too with the anxiety and the lack of sleep and just that kind of jumping out of your skin feeling. There's also loperamide, also known as Imodium, which it helps your digestive system slow down, so it will help correct the diarrhea that you tend to get during opioid withdrawal. It is actually an opioid that doesn't cross the blood-brain barrier, so it works really well for that without actually influencing your mind. And you might even take something as basic as an NSAID, like ibuprofen, for aches and pains. So, that is sort of the full set of comfort meds for opioid withdrawal. Many of them can also be used for benzo withdrawal, particularly gabapentin, although you got to be careful with that because it can adjust the seizure threshold. So, yeah, you've got to use these medications. The thing is, you need to use them sparingly. And in particular, I call tapering, it's like the boot camp of recovery, because it's like everything that you need to succeed in long-term recovery, you need urgently during this long tapering process where you're experiencing significant withdrawal symptoms. And one of those things, the reason I'm bringing this up, one of those things that you need to get away from the mentality of I feel X symptom, I'm going to take Y drug. Okay, so what I'll tell myself is, okay, I'm feeling really I can't sleep. Okay, it's 11 o'clock, I can't sleep. It's midnight, I can't sleep. I got to work tomorrow. It's 1 o'clock, and I'll tell myself, all right, sit here, do breathing exercises, do some DBT and CBT stuff. And if it's 1:45 or 2 o'clock, you've been sitting with this for 2 hours, then you can take maybe a clonidine or hydroxyzine or a gabapentin and see if it'll help you fall asleep. So you got to retrain your mind not to be over reliant on these medications, but at the same time, if you don't use any medications at all, your chances of failing in your taper are drastically increased. You know, I say this all the time, but cold turkey off of opioids in particular is almost a myth. You know, you will find people who have gotten clean that way here and there, but it is exceptionally rare. And most of the people who say they cold turkeyed it, they were in fact using other medications, you know, to support them. They just mean that they stopped the opioid agent entirely, completely at the beginning. So comfort meds play a huge role in this. You know, it's really tough. The deck is stacked against us in so many ways once we become addicted and dependent on these physically addictive depressants. Give yourself the cards that you can, you know, deal yourself back the cards that you can to make the deck not so stacked against you. And those include comfort meds. Now, the other caveat with this is be careful with other addictive medication classes, especially benzos, okay? In general, unless you are sure, and I mean sure, that you are one of those people who can take Xanax, you know, once every 2 or 3 days for 2 weeks or 3 weeks and then be done with it, not touch it again. You're not going to take some and then take a bunch more. Once that disinhibition hits, it's like being drunk. You're not going to take some and then feel a little bit out of it and call your dealer and get your opioid of choice. You know, you've got to be sure you're the person who can take it responsibly, and you've got to use it PRN. Okay, so only as needed on a short-term basis, because if you take it longer than that, first of all, you're at a very high risk of becoming dependent and or addicted because you have already been addicted to another depressant, and cross-addiction risk is very high. Secondly, your body will, so because of that, your body will very quickly come to expect this. You're going to experience worse anxiety and insomnia in between doses. You're going to experience the need to increase your dose. So if you start taking benzos regularly during opioid withdrawal, more of the story is you're very likely to end up on benzos, and let me tell you, that withdrawal is as protracted and as or more awful and certainly more dangerous than opioid withdrawal. So best thing is just to avoid benzos entirely. If you got to take something in that sort of general set of effects, gabapentin is a much better choice that is less addictive and that is easier to come off of. So yeah, there's that with the comfort meds. The next point is so sort of simple, and it will make as much of an impact as anything else you can do, and it's you have to get physical exercise. Like, and I know when you are in the roughest parts of your taper, there is nothing that will appeal to you less than going out for a jog or doing some weightlifting or something to get your heart rate up and your blood flowing and the sweat coming out of you. You know, like that's absolutely not going to be an appetizing idea, but nothing will help your physiology to regenerate more quickly and give you more of a boost than incorporating some exercise, even just light exercise into your taper. You know, doing exercise in some capacity every single day is absolutely crucial. It helps you to decrease your anxiety. It helps you to just to sort of like get comfortable in your body again. It helps you to sleep, and together with that exercise, you got to eat well. There's some evidence that a ketogenic diet that avoids simple carbs, that spikes your blood sugar up and down, that can sort of stabilize you, and that for that reason it can help with tapering, it can help with early recovery, and it can even help with things like bipolar disorder. So you might want to look into ketogenic diets. You might want to look into things like maybe paleo, intermittent fasting, because tapering is an awesome time to get healthy, to get back into exercise. You're going to be building your endorphins back up, those natural feel-good chemicals that target those same midbrain pleasure pleasure centers that drugs did. You're going to be releasing some dopamine naturally. So physical exercise is really important. You also need to stay hydrated, and you need to eat well together with that. So again, that's a basic one, but it is arguably one of the most important points out of all of these. So next thing I want to touch on is therapy. Okay, so I'm talking about not just dependence, but addiction when I'm talking about this point. And addiction is so much more than just I'm physically dependent on this substance and I need to get off of it, and then I've hit the finish line. Like, yeah, once you're off of the substance and you're no longer physically dependent on it, I call it happiness without a half-life. And it's like, yeah, that is an amazing achievement, but you're going to be right back in it if you don't readjust your thinking, because there is this whole diseased way of sort of like only remembering the good, romanticizing the good about your addiction and forgetting the bad. There's this whole way of talking yourself into using and talking yourself into relapse because of your anxiety, because of your insomnia, because of your kids, your work, whatever. Like, there are so many things connected to addiction, like psychological processes that are off, that are warped by addiction, that are still going to be warped. Just because you taper off doesn't inherently, make your thinking and your feeling healthy again. So you're going to need some therapy in some form to help with that. And there are two primary modes of therapy that I want to stress with that. The first is CBT, cognitive behavioral therapy. This is a lot of challenging thinking that doesn't serve you and reframing things. So one just basic example is, for me, when I'm tapering off of these opioids, I get this terrible anxiety. And I talk myself into, oh my God, I'm freaking out. Oh my God, I'm not going to seem normal to other people, and I'm going to seem weird at work. And like, instead of that, CBT will like challenge that. It will remind me, I've made it through all these other days of withdrawal just fine. Okay, there's no one outside of me telling me that I look or seem weird. That's just a fear of mine that's not borne out by evidence. And by the way, that feeling of, oh my God, like I tell myself, that's very similar to the feeling of like the come up on E. Maybe that's not the best healthy thought to replace it with, but that is what I tell myself. I tell myself it's almost like taking a stimulant. I've got energy, I've got creativity. There are so many good things that come along with what my mind is tagging as a discomfort or even a pain, okay? And CBT will help you shift those mental labels. It will help you change the direction of your thinking so that it's compatible with recovery instead of just talking yourself into relapse endlessly. So CBT changes your thinking in a way that challenges core beliefs that aren't healthy or helpful, and that shifts you away from the modes of thinking and feeling that kept you trapped in your daily use of whatever substance you're getting off of. So CBT is awesome, and all you have to do is YouTube CBT exercises, and you can find so many resources. I'm not saying you necessarily need to go and sit down with a therapist, although I think that's a wonderful thing for every human being to do at some point if you're not interested in just going through life like an automaton, But the other therapeutic modality, I should say, that I'm talking about is DBT. In my opinion, this is the most helpful set of tools for getting off of drugs and for early recovery. DBT means dialectical behavioral therapy. It was originally developed for people with borderline personality disorder. It has to do with mindfulness, with staying in the moment. It has to do with radical acceptance of your mind and body, and with tolerating discomfort without acting out or, being impulsive, which in our case often means relapsing or, blowing up on other people, things like that. It also has a component of how to communicate clearly and effectively. So DBT also incorporates some physio hacks to like lower your heart rate, to stop panic attacks. So once again, there's a plethora of resources available on YouTube and online for free to help you with DBT. I would start with the mindfulness stuff because to me, the core of addiction is not being able to sit with yourself in the present moment in peace. If I had to reduce all of the complex factors that propel me toward addiction to one single thing, it would be that I couldn't sit in the present moment in peace. And DBT will help you do that, especially through those mindfulness exercises, through those radical acceptance exercises. So highly recommend that you engage with those therapeutic tools and that you get some grounding in DBT and CBT, including some kind of mindfulness regimen, maybe progressive muscle relaxation. Again, you can just have so much fun. All this stuff is available for free on YouTube. And in early recovery or tapering, I will try a different like sleep meditation medication every night, and some of them are goofy and some of them are just like totally ineffective, and many of them are helpful and relaxing. And if nothing else, distraction is like 3/5 of the game with this tapering, the psychology of this tapering stuff, and it's gonna get your mind off of whatever is uncomfortable in the moment. So try out DBT and CBT. It's certainly not going to hurt. My next suggestion is journaling. It is so powerfully motivating to be able to just see the list of this is why I am, getting off of X substance. And journaling is a great way to remind yourself every time you write out why you're doing this, you reinforce it and you refill your sort of fuel tank of purpose to get this very difficult thing done. And make no mistake, tapering off of opioids is, even if you do it very low, very slow, it's one of the most difficult things you can ever do. You're giving up your comfort, you're giving up your ease and your happiness temporarily for things that in the end are much greater and healthier. But temporarily, you are taking a lot of L's for something that your body and mind are telling you is it's a huge loss. So you're not seeing the W for a long time, and it's difficult. So before I get terminally off track here, journal, tell yourself how you're doing, monitor your mind and body. That will also help you to check in with yourself about, am I going too quickly? Am I sort of not spending enough time adjusting to my new dosage? And because of that, it's all catching up with me in the worst way, So if you write a little bit every day, at least a couple paragraphs, then you will be able to, sort of keep track of yourself. And it will be an amazing, beautiful thing at the end, I promise you, to look back on this journal and see like, wow, I did this super difficult thing. Look how much I changed along the way. Look at how much better I am now. And, it just builds you up, pumps you up for life to realize that there are incredibly difficult things that you can do, and you're the engineer and the author of all these possibilities for yourself. Together with the journaling, I would say creativity is healing for me, even if it's something I'm not good at. I'm terrible at visual art, and I love mandalas and stuff like that, just drawing or sketching during recovery. It heals something that's hurt by addiction. That's the simplest way I can describe it. You will also probably want to seek community of some type, whether it's smart recovery, whether it's just getting involved in a hiking group or a running group. A lot of tapering takes place in your head, and there's a saying in the program, if you're an addict alone in your head, it's a dangerous, bad place to be, right? And it can be true, especially during the early stage. That shouldn't hold true forever, but during the early stages, that can be true. Seeking out some kind of positive community, whether it's related to you getting off of whatever substance you're tapering off of, or whether it's just a healthy, fun, new hobby, that will help to bring new blood into your life. I always tell people, when you're giving something up that has brought you comfort and relief, you have to substitute it with something like that psychological vacuum that would otherwise be there is going to be filled in by something. And because addiction is a negative sort of diseased process, if you don't consciously fill that gap in with CBT and DBT tools, with creativity, with new healthy connections with people and relying on people instead of substances, if you don't do that, the default is going to be you're going to succumb to other addictions. It might be food, it might be gambling, or other impulsive and compulsive behavior. So you got to be deliberate, and you got to avoid leaving a vacuum, a bad habit vacuum, So all together there, it's kind of highly recommend journaling, creativity, and also seeking community of some form. Stevie Nicks has talked about, the Fleetwood Mac and then solo artist, rock goddess. She's talked about how coming off of Klonopin was so much darker and worse than any place that her cocaine addiction, which was legendary, took her. She did say she was in the hospital for a month coming off of Klonopin, and she said that this really powerful benzo left her in a state. She said it felt like someone had pushed open the door to hell and sent me through it. She said something along those lines. But she also said she was writing beautiful, powerful lyrics for the first time in years during those weeks in the hospital. So this time of tapering can be a time of your brain coming back online fully. Your emotions are supercharged, and there is so much positivity and possibility connected to that. So find that, seek that out. It will naturally help you see what CBT teaches you, which is that there are so many plus sides to what initially seems to be just a big L, like I've been talking about. All right, so avoid the pitfalls is the next point, and by pitfalls I mean hugely alcohol. Okay, alcohol has no benefit. It might make you feel better for 45 minutes or an hour, but it makes your stomach problems worse. It will give you rebound anxiety and insomnia. Even if you drink a lot and you pass out, it destroys your REM sleep so that your sleep isn't restful. It depletes your body of key nutrients at a time when you're supposed to be healing. It dehydrates you. Alcohol is a loss across the board. If you just need some kind of high to get out of your discomfort for a while, weed is a better option. Marijuana is a better option. I don't think it's the right thing for most people to lean into that too heavily during their tapering process for complex reasons. And I'm not going to get into too much here, but basically the cross addiction thing is a huge part of it. But alcohol is the absolute worst thing you can do, and too much caffeine is also a no-no. You know, you're already not sleeping. You're already just uncomfortable and feeling jittery and uncomfortable in your skin. You are really not going to want to put the gasoline of caffeine on that particular fire. So again, be on the alert for replacement addictions. The first time I got off of Suboxone, I ended up in a space where I was running for 90 minutes to 2 hours on the treadmill every single day. I did that every single day without a break until I got stress fractures in my shins that were so bad that one night I woke up to go to the bathroom in the middle of the night. I stood up and I just fell over. My legs crumpled under me because the pain was so severe when I put weight on it. So you got to make sure even things that come on as like healthy, you got to look out for obsession about food and exercise. A lot of that, I talk about this and I have an upcoming video about this. A lot of the neurological changes that are associated with addiction are very similar to what happens in eating disorders and in obsessive compulsive disorder. So you've got to be on the lookout for, am I really moving toward health, or am I switching that obsessiveness that is at the heart of addiction to something else like food or exercise or sex? Because we are doing this to get toward health. If you're just substituting, you know, one bad habit for another, it's like they say you're changing lifeboats on, you're changing seats on the Titanic, you know, would be a better analogy, because potentially the lifeboat could have saved you, right? So you don't want to change seats on this Titanic. You want to just make sure that you're truly moving toward health. So avoid alcohol, caffeine, and other compulsive and addictive behaviors. Finally, and thank you for listening this long if you made it this far. Hope you found some worthwhile content. If you did, please like and subscribe, and got a ton more videos coming out about all kinds of things related to the science and policy of addiction. I've got some crazy sort of war stories from my time in China that I'm going to be matching with photos from those years and producing as well. So yeah, please hang around. Final point is reward yourself. Again, this is one that sounds simple, but in my experience, tapering is so physically and mentally rigorous, and you get so focused on the details, you forget, like, I'm doing something amazing every single day. Every single day that I follow my taper protocol is one step on the journey toward much greater health. You know, reward yourself along the way. You know, give yourself extra time to, maybe it could be something as simple as taking a nap, as reading a book for 30 minutes when you would normally just jump into another productive activity. Take a day off of or a day off of work 1 week and just sort of like purely enjoy it, doing whatever you want to do, you know, just these small things to tell yourself that you know, like the truth that you're doing something absolutely amazing and that you deserve to be rewarded for it along the way, and just to sort of enjoy the journey and check in with yourself and make sure that everything is on track for the rest of your life, sort of avoiding the problems that have got you to this situation in the first place. So that was like the ultimate run-on sentence, and it's probably a sign that I have been talking for too long. So thank you guys again for tuning in. I hope that this information was useful, and let me know what you thought of it below. So hope you all have a wonderful day, evening, whatever, and I will see you next time.